Have you ever felt that you have gotten less than excellent care when visiting your doctor's office or during your stay at the hospital? Did you feel like just another face in the crowd instead of an individual? While not everyone's healthcare experience is like this, many people feel that their care is impersonal. In an article on the Psych Central website, last updated in 2014, Lauren Suval summed up the importance of quality care from physicians in the following quote: "I think it's important for them to remember why they've entered the field in the first place. If it's because they sincerely want to help people, it's crucial to know how to relate to patients on an emotional level." I believe this could be applied to any career in the healthcare field. Healthcare professionals should be required to begin their careers as a certified nurse's assistant, or CNA. Experience while working as a CNA can benefit those who choose to pursue a career in healthcare by giving them the opportunity to learn to love to provide care for others. Today, we will examine 3 important reasons why beginning as a CNA should be a requirement for all healthcare providers. First, we will discuss how it can help determine if healthcare is the right career choice. Then, we will look at how it helps professionals work together as a team. And finally, we'll explore how it can help improve bedside manner. Excellent bedside manner, teamwork, and providers who enjoy their careers all help ensure that you receive the best possible care whenever you find yourself in need of healthcare. Prior experience as a CNA can help healthcare professionals develop these characteristics. When choosing a career, it is important that you find the job you will be performing enjoyable. In an article posted on About.com in 2014 by Andrea Santiago, a medical recruiter, she stated that although a medical career is extremely rewarding and often lucrative, healthcare professionals experience high levels of stress, and the field requires a great deal of commitment, endurance, and hard work. Being a CNA can help determine if healthcare is the right career choice because it provides experience with patient care. I have worked as a CNA in a nursing home for the past 4 years. The reason I chose to become licensed as a CNA was to help determine if my lifelong dream of becoming a registered nurse was logical. As it turned out, I thoroughly enjoyed caring for the residents, so I determined that I had chosen the correct career path. Since beginning clinical training in nursing school, I have discovered that being a CNA has given me an advantage over my peers without prior experience in the healthcare field. I already know how to provide basic care for my patients, so I can focus on the more technical aspects of care that registered nurses must know. For example, instead of worrying about how to give my patient a shower, I can focus on the multiple medications that they are receiving. Prior experience as a CNA allows one to flow more seamlessly into the world of patient care as they begin their professional career. Healthcare workers must also have a passion for helping others in order to thoroughly enjoy their career choice. In a personal interview via email on July 27, 2014, with Marlene Kears, a registered nurse who has worked in the ICU setting for 24 years, she stated that through her experience, she has noticed that when someone thoroughly enjoys their job, they provide higher quality care for patients. Healthcare is not a career for those who are only worried about their paycheck, because it is centered on others instead of oneself. Working as a CNA helps to determine if that passion is present, so that a healthcare career will be enjoyable and not dreaded, because the attitude of the care provider is evident to the patient. Choosing a career that suits you can be beneficial to you and the customers you serve, but it is also important to be a team player, especially in the healthcare profession. Teamwork is the key to quality patient care. No one person can meet all of the different needs of a single patient, so it requires a team to provide complete care. Each member of the team plays an important role, and it is critical for all team members to respect the position of one another. If one team member decides that another is not valuable, then it creates a hostile environment and the patient care suffers. In my personal interview on July 27, 2014, with Marlene Kears, a registered nurse, she discussed how many physicians and other healthcare professionals that she has encountered over the years look down on the CNA position and take for granted the work that they do. First-hand experience as a CNA would give healthcare professionals a greater respect for the work that CNAs do, even after they reach their higher career goals. Since CNAs provide basic care for patients, they spend a lot of time with them and can gather critical information. Sometimes this information is not well received by those in superior positions because they do not trust CNAs as an information source. However, if one had prior experience working as a CNA, they would understand that the close proximity between aides and patients allows for an abundance of information to be learned and be more likely to value the opinion of a CNA. Teamwork and communication among healthcare professionals is important. However, interaction with the patient and their family is a critical component as well. In an article on the World website published in 2014, Loriana DiGiorgio discussed what patients felt was important when receiving healthcare, including that many desire to have a trustful and empathetic relationship with their healthcare provider. The ability to form this type of relationship with patients is commonly referred to as bedside manner. The Merriam-Webster Dictionary website, last updated in 2014, defines bedside manner as the manner that a physician assumes towards patients. The bedside manner of healthcare professionals is highly valued by patients. According to an article by Lawrence Subal on the Psych Central website, last updated in 2014, eye contact, genuine interest, unrushed manner, and good communication are all markers of good bedside manner. Bedside manner skills taught in a classroom are no comparison for the skills learned through experience. CNAs who are willing develop wonderful bedside manner skills because they spend a lot of time with patients, caring for their basic needs. They also gain experience in using effective communication skills with ailing, sad, upset, and tense patients. These skills can be learned by professionals as well, but working as a CNA first provides them with a good base of experience before entering their career. In an article posted in 2005, Damon Adams discusses how good bedside manner helps keep patients coming back to the same provider and institution. Therefore, it is in a healthcare professional's best interest to possess good bedside manner skills at the beginning of their career, and prior CNA experience is a great way to get started. Experience while working as a certified nurse's assistant can benefit those who choose to pursue a career in healthcare by giving them the opportunity to learn to love to provide care for others. Today, we examined 3 important reasons why beginning as a CNA should be a requirement for all healthcare providers. First, we discussed how it can help determine if healthcare is the right career choice. Then, we looked at how it helps professionals work together as a team. And finally, we explored how it can improve bedside manner. CNAs are the core of quality healthcare. They hold the hands of the dying, provide comfort for the sick, care for those who can no longer care for themselves, and build quality professional relationships with the patients they care for. These skills can be carried through to professional careers of those choosing to begin their healthcare career journey as a CNA, in order to provide quality care for all, including you and your family.